Ms. Irene Quay.
Question 16, thank you.
Mr. Speaker, the healthcare institutions are required to meet core governance, clinical, and patient safety and welfare requirements as stipulated in the legislation, as well as licensing and regulatory framework of the Ministry of Health. MOH carries out regular inspections to verify that these requirements are complied with. These requirements are renewed regularly to ensure they remain relevant. For example, following a review and public consultation, MOH is working towards replacing the current Private Hospitals and Medical Clinics Act, or PHMCA, with a new healthcare services bill that will better meet the needs of a changing healthcare landscape. At the systems level, MOH also benchmarked the performance of our system against international counterparts. We examined how our care outcomes fare in international studies, such as the EIU's Healthcare Outcomes Index, Bloomberg's Global Health Index, and WHO's World Health Statistics Report. We also benchmark ourselves in specific areas, such as our mortality rates in key diseases versus OECD countries. Singapore's healthcare system has fared well in many of these international comparisons and studies. In addition to these efforts, MOH encourages and supports quality improvements in healthcare institutions through different initiatives such as performance monitoring and quality improvement programs to help healthcare institutions achieve better care quality and excellence. Some healthcare institutions have voluntarily undertaken the external accreditations, such as those provided by Joint Commission International, or JCI. These accreditations have been useful in helping our healthcare institutions make continual improvements in their service standards and quality, but we will need to mature beyond traditional accreditation. Our healthcare landscape is rapidly changing, with emerging challenges in an aging population, increased complexity of care needs, and limited workforce growth. To meet our unique needs, MOH is working with healthcare institutions to develop our own models of care. We are also partnering them, as well as leading international organizations such as JCI, to develop more customized quality regimes and standards that meet our own needs without imposing excessive burden on the healthcare workforce.
Ms. Irene Quay.
Can I ask SMS when will be the timeline for implementation of this new audit system?
Currently, MOH is actually working with the National Quality Council and the clusters PHIs to chart our way forward to ensure that there will be continued care quality and safety. And we are actually also engaging leading international organizations, including JCI, as well as the Australian Council for Healthcare Standards, or ACHS, to share some of the needs of our Singapore healthcare system, so that whatever suggestions that have been submitted to us actually meets our unique circumstances. And one of the purpose of this is actually to move away from the focus on just relentless auditing, which many healthcare workers have actually feedback to us. As to the timeline, we will have to come back to Ms. Irene Quay once we have finalized the decision, and will update the House as appropriate.